Okay, great. So I want to thank everybody for joining us today. This is the second session of the second week, first day of our annual conference. And we've been offering the virtual sections now for 2 weeks, and we're everybody who has joined us and participated in all of our sessions. So thank you so much. Today, I'm really excited to welcome Dr. Amy Belisle, the Chief Health Officer for the Maine Department of Health and Human Services, and Dr. Letourneau, a Senior Advisor in Delivery Systems Change in the Department of Health and Human Services, to provide us some more information around vaccinations in the state of Maine, specifically related to the COVID-19 vaccination for our children with special healthcare needs. We will be recording the webinar today, and we will also have it up on our website and on YouTube, hopefully by the end of this week. If you have any questions, please feel free to use the chat box. I'll be monitoring the chat box. And with that, I'm excited to turn it over to Amy and Lisa. Thank you, ladies, for joining us. And off you go.
Great, thank you. So I think we agreed, Amy, I would start, right? So thanks everybody for joining and for the invitation. I'm Lisa Luterno. I'm an internist by background and currently serve as a senior advisor in Commissioner Lambrew's office and work closely with Dr. Belisle on lots of different things, but currently a lot of things related to COVID vaccine, including trying to provide education for clinicians and community members. So we appreciate your interest. Always like to start out with the recognition that the story of the vaccines that have been developed so quickly is pretty amazing. I often call it the moonshot of our generation in terms of the use of technology to solve a critically important problem, but the vaccines themselves don't save lives, the vaccinations do, right? So how do we build the knowledge and understanding and confidence of people so that they will feel comfortable accepting these vaccines? So we've got some information we put together that goes through a wide range of topics. We will admittedly go a bit quickly, but we're happy to answer questions and want to make sure that we save plenty of time for that. So I think it starts out with, why even get the vaccine? And people often, sometimes we'll hear folks say, well, it's not that big a deal. We're going to have to wear the masks and distance anyway. Why should we bother getting it? And I think the key thing is it helps prevent you from getting seriously ill or dying from COVID. And while, yes, disease is typically less severe in young people, it can be severe. It can result in long-term illness, and it can sometimes sadly result in death, even in young people. Additionally, even while yes, we will need to continue some measures like masking and distancing for some time until enough people get vaccinated. We do know that the more people who get vaccinated quickly, the better our chances are for getting back to our normal lives as quickly as possible. There's also, I think, a lot of questions about just how these vaccines work, and particularly because there are several of them now, right? Several different ones. And the bottom line is that they ultimately all work in the same way. They have different ways of getting essentially the recipe for creating antibodies, the body's natural way for fighting this disease, this virus. They have different ways of getting that sort of recipe, that genetic recipe into the cell, but they ultimately all use a portion of essentially the genetic code from the SARS-CoV-2 virus, which is the coronavirus that causes COVID-19, to then trigger the production of these little spike proteins, the red proteins that you see on the pictures of the coronavirus, then helps your body to create the antibodies and other elements of the immune response so that your body then acts as though you've already had an infection to COVID to then be able to fight it off if you do encounter it again after being vaccinated. The important part is it really gives you protection to the disease without getting the disease, right? You get the material to make the antibodies, but you don't actually get sick with COVID. We also hear a lot of concerns about, well, how do we know the vaccines are safe? And that we know that because the same process was followed to create these vaccines as has been used for any other vaccine, just on an accelerated, admittedly a dramatically accelerated timeline. The most important part is that all of the development of these vaccines included the use of large clinical trials with tens of thousands of people of different ages, races, ethnicities, and medical conditions. And importantly, that those data are reviewed not only by the US Food and Drug Administration or FDA, but by an independent advisory committee that reviews the data. We know that these groups review based on both efficacy and safety, and also that the technologies used to create these vaccines are not brand new. So the first two vaccines that were authorized, sorry, and they have received emergency use authorization. There just has not been enough time to go through the full FDA approval process, but they've been authorized for use in this emergency setting, are these messenger RNA or mRNA vaccines, which are the first to be authorized by the FDA, but there have been several others that have been developed specifically for other conditions such as Zika or Ebola over the past 10 years or so. They just didn't get all the way to previously EUA or approval because other vaccines beat them out in the process. And when a manufacturer has to decide, how to spend their precious dollars, typically they're not going to pursue a vaccine if there's already one out there. In this case, the vaccines were developed with really unprecedented global support, financial support from countries and other agencies around the world. And so the manufacturers were able to invest in the development, even the production of those vaccines, to get them done more quickly than would normally happen. But this is kind of a busy slide. I apologize. But basically, we're just showing the whole process from the very exploratory to animal studies to clinical trials, to FDA review, all happened still just again on an accelerated timeline with some overlapping of phases. And then eventually, again, this EUA, emergency use authorization from the FDA, that looked at the results and said the benefits were greater than the risk of getting COVID. And again, related to that, how can we know that they're still safe while being developed quickly? Again, part of this was that the work was able to be accelerated. It was based on work that had already been done. Researchers were able to shave off some time by using existing clinical trial networks. And again, probably most importantly, that manufacturing started even before the authorization was obtained because they had investment funds to invest in that production. So that, and you saw, right, when the FDA gave that emergency use authorization to these first three vaccines, literally it happened on one day, and within the next day, you're reading the vaccines are being shipped because they've already been produced. Again, that would never happen in other situations. So the vaccines have a lot in common. There's some key facts. Number one, that they help prevent you from getting seriously ill and dying with COVID. We also know that some people will say, well, I've already got COVID. Why should I bother to get immunized? We know that there's still benefit of getting the vaccination because it's a more reliable immune response. Importantly, none of the COVID vaccines include live virus, so they cannot give you COVID. And they will not cause you to test positive on tests. People say, well, I don't want to have it show up like I've had, like I have the disease, and that just does not happen. There are now 3 vaccines that have received this emergency use authorization from the FDA. I mentioned the first 2 are these messenger or mRNA vaccines, one made by Pfizer, one made by Moderna. The third one uses a different way of getting that sort of, again, genetic material, the recipe for creating the antibodies into the cell. That's called a viral vector. It literally uses another virus, but one that does not replicate in the cell, to get that genetic material inside the cell. That one is from Johnson & Johnson, and specifically their division called Janssen. You see it sometimes referred to as either way. All 3 are highly effective at protecting people, again, from getting seriously ill or dying, and all have been 100% effective in preventing people from death from COVID. All 3, I mentioned, were tested in large clinical trials. Those trials included a range of people from different race, ethnicity, and ages. And again, none of those showed any significant safety concerns. Again, a busy slide, but you can see the similarities and differences across these 3. I've mentioned several of the similarities already. one of the most important differences that people point to is this efficacy number, right? So, well, maybe I don't want J&J because its efficacy isn't quite as high as Pfizer Moderna. But one needs to recognize it's not an apples and apples comparison. I probably shouldn't make the slide like this because it makes you want to compare. But the reality is, it's not fair to compare a clinical trial result for a vaccine that was tested at a different time, which J&J was, and in different countries around the world because of the emergence of variants, right? Because of the emergence of viral variants, the virus mutates as it replicates or reproduces itself quickly. And so the J&J was tested in different countries and at different times. So if you actually tested the other two in the current scenario right now, you may as well, you might very well get similar kinds of results. And most importantly, the fact that, again, this is efficacy against getting the disease at all, but they are all equally protect 100% in preventing death, and all highly similar in preventing serious disease. Um, Also, the Pfizer and Moderna are two-dose vaccines. J&J is a single dose, which offers a lot of advantage in terms of being able to get this out quickly to people. Pfizer's given 21 days apart, Moderna 28. There is some flexibility there. They're all been tested so far primarily for adults. Pfizer did include young adults 16 and older. The other two are for 18. There are trials underway, and I think Amy will talk about this in terms of eventually we do think they will be authorized for younger people as well. The first two also have very high cold storage requirements because of how quickly the mRNA is broken down. They have to be stored at very cold temperatures versus J&J can just be normal refrigeration, which also gives a lot of flexibility to it. People ask, well, what's in them exactly? And how do I know, again, that they don't have additives that are unsafe for me? And the bottom line is they really contain very little. They contain some piece of that genetic material that codes for the production of that spike protein I mentioned, so that triggers the immune response in the body. And then some stabilizing agents, some sort of fats, salts, and sugars that help to stabilize that. But importantly, they do not contain, again, any live virus whatsoever, any of the typical preservatives that are in many of the others. They do not contain fetal cells. You hear that for some. It is true that a fetal cell line was used to help in the development of one of them, the J&J, but they do not contain fetal cells themselves in the vaccine or any of these others. We hear these active disinformation campaigns that say, well, there's pork products or GPS devices. None of that is true. We also, understandably, because we talk about these vaccines, including genetic material, mRNA or DNA, people have asked, well, how do I know that this isn't, genetic experimentation that is going to change my DNA? And the answer is it doesn't. It does not go into the nucleus of your cell. It goes into the cytoplasm, the sort of fluid surrounding the nucleus where your own DNA is stored, and it does not interact with our own DNA. The genetic material, the mRNA and DNA, that again triggers the production of that spike protein that then triggers the immune response, is very unstable and quickly gets broken down. So it sort of does its job and then it gets broken down very quickly in the cell. Again, the question about, well, isn't it getting just the natural infection better than getting a vaccine? And the answer is no, because people have different levels of infection from the natural infection, and the immune response is not as predictable or as robust as from these vaccines, which luckily seems to be very good. So the vaccine really helps you build your own immunity without the risk of getting sick. Plus, we also know there are real risks of getting the natural infection, including, again, severe illness and death. And with that, I think I'm going to transfer to Amy, but I'll keep advancing the slides, Amy.
Great. Thanks, Lisa, and thanks for having us today. My background, I'm a pediatrician by training, and we've been talking a lot with different groups around the COVID-19 vaccine, especially with women, and in the first round with healthcare providers, because almost 75% of the healthcare workforce is women. So the issues of fertility, pregnancy, and breastfeeding have come up a lot in the last several months in relation to the COVID-19 vaccine. There's no evidence that the vaccine causes fertility problems in men or women. And based on many of the expert panels that we have in the United States for OBGYNs, for maternal fetal medicine who deal with high-risk pregnancies, and for those who are doing fertility medicine. They are all recommending that the vaccines are unlikely to pose any risk for pregnant or breastfeeding women, and they're actually encouraging pregnant women to get vaccinated because pregnant women who get COVID-19 can be very sick around the time of, if they get sick around the time of delivery, they can become very ill. So the recommendation is that pregnant women do get vaccinated upon consultation with their healthcare provider. You can go to the next slide, Lisa. And in terms of for children, like Lisa was just saying, we do have one vaccine, which is the Pfizer vaccine, that will do 16 years and older. So there are those, if your child is within the 16 to 18-year-old age range, they can get the Pfizer vaccine. The Pfizer vaccine is the one that requires the ultra cold storage. It's also the one that you have to give around 3 weeks apart from each other. So there are those 2 doses. So those are some considerations. Moderna and J&J vaccine, if you have an older youth, can be used in 18 years and older. Right now, there's several studies pending. Both the Pfizer vaccine and Moderna are doing studies on children as young as 12 years old right now. Moderna just opened up a new study to study those younger than 12, and the J&J vaccine is starting to open up new studies for younger children. So we're expecting probably, hopefully by the end of, the timeline is probably the end of the summer and into the fall. Hopefully we'll at least have one study completed and another vaccine available for those 12 and up, but we don't have exact timeframes yet on this. And there's also currently additional studies right now around women in pregnancy, the Pfizer vaccine specifically being studied in this age group. And there are several registries that are now available, including the University of Washington, that's tracking pregnant women who are getting the vaccine, across the country. So I know that that's been a concern for many of you, especially those of you who have children who are younger than 16. And that's why we would encourage, once your age group becomes eligible, that you get vaccinated if your child cannot. So is it safe for you to get the COVID vaccine if you have allergies? There's been a lot of press around this. There's been a few cases in the state of those that have had an immediate allergic reaction. So if you've had a history of an immediate allergic reaction with any other kind of vaccine or injectable medicine, you should talk with your doctor. The federal CDC has put out guidance around those who might be at more risk for having an allergic reaction. And so healthcare providers are looking at that guidance when they're talking with you. If you have a history of using an EpiPen for a previous allergy, you should definitely bring that with you to the vaccination site. And just know that there's only a very small group of people that they would not recommend getting either the Pfizer or the Moderna vaccine for specific types of allergies. And in those cases, many of them can get the Johnson & Johnson vaccine. So it's really a conversation with your healthcare provider. People who have severe allergies to medications or foods or pets or bee stings, generally those folks can still get vaccinated. But if you do have a severe allergic reaction to for the Pfizer or the Moderna, which are the mRNA vaccines, one that requires epinephrine, requires immediate medical attention after the first dose, you should not get the second dose as the mRNA vaccine. And in that case, in most settings, they will refer you to an allergist. We know that there are not that many allergists in Maine, but the allergists are definitely taking a lot of telephone calls and consultations from different provider groups around this issue. You can go to the next slide. But we do want people to be aware that most people are going to have some side effects when they're getting vaccinated, and that's normal, and that's your body's response to the vaccine. Very few people have severe side effects, but often, especially with the second dose, we're seeing more reactions. Most people will have some side effects, including they might be tired. They could have pain at the injection site like you would normally with a vaccine. Many people report chills and fevers. It's okay to take Tylenol if you have chills or fevers after the vaccine, although we don't recommend pre-medicating before a vaccine, because you really do want your body to have a good immune response to it. Some folks report headaches and muscle aches and joint pain, and a few people talk about nausea and vomiting. Some things that we have seen are a local skin reaction, so almost like a bullseye on your arm around where the injection site is. And that can last, for some people, they might not see that right away. Sometimes that starts several days after the injection, but it can last up to 10 days. In those cases, it's really Tylenol, cold compresses. There's nothing special you would do for that. It generally just resolves on its own. But when you see it, it's obviously very worrisome, and you want to know, often people will call their provider and see if there's anything that they should be doing. The other thing is that, like I said before, second doses, people tend to have more side effects. If any of you have been vaccinated, you may have experienced that. My husband is a healthcare provider, and after the first vaccine, he had a little tiredness, a fever, and chills. The second vaccine, he really didn't feel well for about 48 hours. Really just kind of knocked him down for a couple of days, and then he was fine. So I think that that's, just to be expected, that you might have a pretty significant response with the second one, and just plan your schedule accordingly on that side. The other thing is generally, if you're having symptoms after the vaccine of cough, shortness of breath, loss of taste, a loss of sense of their taste or smell, some people are getting COVID not from the vaccination, but they may have been exposed to COVID prior to being vaccinated and they were asymptomatic. So if you're having symptoms of COVID, especially after the first vaccine, you should definitely get tested. It generally takes at least 2 weeks to get a robust immune response. And with the single dose J&J, although they say 2 weeks, it could be up to 4 weeks before you're getting a really good immune response. So we're still watching for signs of COVID. And with the variants that are out in the community, if you think that you may have COVID even after being vaccinated, you still should get tested. You can go to the next slide, Lisa. In terms of how do we know that they don't cause long-term side effects, the ingredients used are not associated with long-term side effects. Really, there's been a lot of testing on these vaccines. Millions of people have gotten them at this point. They've been held to the same safety standards as all vaccines. The federal CDC and the FDA continue to monitor for side effects. So one is through the VAERS system, which is the Vaccine Adverse Event Reporting System, which is the normal vaccine reporting system around adverse events. But with COVID, they've set up Be Safe after vaccination. So you can log in after getting your vaccine and report your symptoms up to 14 days afterwards. You can go to the next slide, Lisa. So I said before, it takes about 2 weeks after finishing vaccination to be fully protected. I would say some of it with Johnson & Johnson, they're saying up to a month. So you still got to be pretty careful after vaccination, washing your hands, wearing your masks, still social distancing. There have been a few cases where people were sick prior to getting the vaccine. They just didn't know that, or they've been exposed and they haven't had enough time after being vaccinated to build up enough protection. So if you still feel like you've got COVID symptoms, you should still get tested. We don't know how long the protection of the COVID-19 vaccines are going to last. There's been some talk about whether or not people will need a booster in the future or a booster with the new variants. We're still waiting for more studies on that and for more guidance. Go to the next slide. So after being vaccinated, you still do need to wear a mask and limit contact with others. The federal CDC has put out guidance, and they put out some guidance pretty much weekly the past couple of weeks on those who are vaccinated and what they can do and who they can be around. So it's best to check with the federal CDC on emerging guidance around those who have been vaccinated. But it's still important to wash your hands, wear your mask, keep your distance, and not being out in big, large groups right now. And as more people get vaccinated, obviously you'll be able to be around more people and get slowly back to life. But we're still recommending that people be cautious at this point, especially because in many groups it's very mixed. Some, like your, those who are our wiser older generation may be vaccinated, but the kids are not. Maybe a parent is vaccinated depending on their age group. So really, you don't know who in the crowd has been vaccinated at this point. In terms of eligibility, right now, because the state gets allotments based on the state population, right now the state is vaccinating Maine residents. So when you're setting up your appointment and going to the appointment site, you should bring proof of residency. Those are those who are living in Maine with the intent to remain indefinitely, or those who entered the state with a job commitment and intend to live in Maine while working in Maine. So they'll ask for a driver's license or state identification card or a bill or piece of mail, or a letter for the employee verifying their employment and their intent to live in Maine. And that's mainly because the supply right now has been so tight that we're just trying to immunize as many Maine residents as possible. And that's pretty consistent across New England, that people are generally vaccinating their own residents.
Amy, a quick question for you. What if you have a 16-year-old, obviously vaccinations are opening up April 19th, who doesn't have their license yet, obviously doesn't have a bill or proof of residency? Would something like a social security card work for them? Do you know?
I would think so with you and your, yes.
With a parent present?
Yes.
Okay.
And we'll add that to our list of questions that we need to get clarified with the 16 to 18-year-olds.
Right. I mean, because there are 16 and 17-year-olds who don't have their licenses yet,
Right.
especially where that has all been delayed over the last year, because I have one of those. He lives with us, but he doesn't get bills in the mail per se. So I didn't know.
Picture school IDs that have,
okay.
I don't know how much details on their picture school IDs. That is a good question, Carrie. As we get to the 16 to 18-year-olds, we're going to have all these little questions that we're going to need to address.
Nuances. Yeah. Okay. Thank you.
The vaccines are free for all Maine residents. The vaccines are being provided from the federal government, paid for the federal government. But one note, the administration fee, the sites can bill your health insurance. So they might be asked for your health insurance, your Medicaid, Medicare cards. If you don't have health insurance, then they should not be directly billing you. If you're self-paid, there's another way for them to get reimbursed for that. So just to know though, if you do have health insurance, you should be bringing your card, because they will bill for that vaccine administration fee. Maine Care is offering free transportation to vaccination appointments. So first you make your vaccine appointment and then you schedule your ride, and you need to call at least 48 hours in advance. Now know that they will leave the patients for the appointment, and then you'll tell them whether or not to come back at 60 or 90 minutes. So it's likely that you'll be waiting a little bit for your ride to go back. At the very high volume sites, they can get people moved through the sites within 35, 45 minutes, depending on how many people are scheduled. But just know that you may have to wait a few minutes for your ride and bring something to do while you're waiting. So that is happening. And I think they've given it probably 500 to 1,000 rides in the first couple of weeks.
Yeah, and just to clarify one thing there, Amy, you said Maine Care, but it's Maine DHHS. So you do not have to be a Maine Care member. Anybody who needs assistance getting a ride to a vaccine site, just to underscore that.
I think that one thing we're hearing from the vaccine sites is that they're starting to see more people bring in their children as they're getting vaccinated. That is potentially a safety risk for the vaccine sites in terms of numbers of people coming in, and also having smaller children wandering around the site. So I think they are encouraging people, if you're coming in, especially in the older age eligibility groups, that just bring the people in that are getting vaccinated, not bring a lot of additional family members or young children with you, because there's just been some concerns as they're seeing more children coming into the sites, and they're just not really set up for them at this point. So I'll just bring that up. If you have difficulty making an appointment, there is a COVID-19 vaccine community vaccination line that people can call. It is open Monday through Friday, 7 a.m. to 7 p.m. and then on Sunday. At this point, it's really for those who don't have internet access or need help going on to the there's the state page that Lisa will show us the link in a minute that has all the sites offering vaccine. But if you're having a hard time navigating that, they can help you with it. But they can't necessarily book you an appointment or provide faster access to the vaccine appointments unless if they are going onto the vaccine site with the person on the line and they find, for example, on the Northern Light system, they have an appointment tomorrow in Portland and they're able to book it for them right then with them, they could do that. But if there aren't appointments available, they're not going to necessarily be able to book faster appointments for them. I will note that there are Pharmacies now, we've got Walmart, we've got Walgreens, we've got Hannaford, we've got Sam's Club that are offering vaccines. Right now, in the phase that we're in, the pharmacies are currently prioritizing the school teachers and staff and childcare staff to the end of the month under the federal directive. And then the state supply, which is supplying most of the large scale vaccination sites and the sites that the practices and that the hospitals are offering vaccine, has been prioritized for those who are over 60. So it's not that the teachers and school staff couldn't go to one of the larger vaccine sites, but they're being prioritized at the pharmacies, whereas the 60-year-olds are being prioritized at the larger scale sites. That's where we are currently in the phases. Last week on Friday, they announced that we're going to start with the 50-year-olds. So today is the first day for 50-year-olds and older. And then on April 19th, it's all others who are 16-year-olds and older. That's going to open up. A lot of this has been predicated on getting more federal supply coming in, and that the thought is that we're going to start to see more vaccine in the next couple of weeks. The vaccine currently in March has still been, a pretty steady restricted state of supply. So just, I think people were wondering, are we getting a lot more vaccine right now? Currently not, but we're hoping in the next few weeks, we're going to start to see more vaccine supply come into the state. The governor's website does have the number of vaccine doses administered, so 581,000, showing both the first and final dose. The first dose numbers are Pfizer and Moderna. The second dose numbers captures both the Johnson & Johnson, Pfizer, Moderna, all in that second dose there. And then you can see the eligibility is on the governor's website, as well as there's a frequently asked questions. And underneath the vaccine eligibility is find the COVID-19 vaccine site in Maine. You can go to that site. It will list all the sites by town, as well as the links and the phone numbers to schedule appointments. Every place has a little bit different of a system, but that is available. Most of them are doing, for example, Northern Light has real-time, no waitlist appointments. You may have seen in the last couple of weeks that Maine Health, in addition to doing their vaccine phone number, now has a way you can go online and either register if you're in the eligible group or pre-register if you're not in the eligibility groups yet. And people have found that helpful to go in and do that online as well. And the pharmacies have their own sites that they're registering on, and those are more real-time. Most of them do not have wait lists.
So I think what's important, just to reiterate here, Amy, because every state's doing it differently, there's no one place in the state of Maine to go and register for vaccination. I know some states have moved to a system where you register with the state and the state calls you. You have to check with all the different providers who are providing vaccinations. So there's many different places for you to check once you become eligible for places for you to get vaccinated. So check with the pharmacies in your areas that are providing the vaccinations. And like Amy's mentioned, Maine Health and Northern Light are also providers. And then there are clinics that pop up. Like there's one in Sanford. I think there's one at the Augusta Civic Center. So it's important that you're checking all of those sites to get access to vaccination. And it would be your job to register with those individual sites for an appointment. There's not one place to go in Maine to register. That's what I'm hearing from you, Amy. I just want to make sure I'm correct on that.
Yep, that is currently what's happening in the state. The state is moving on setting up a pre-registration, but when that happens, they'll start with the small number of sites before it expands out. And many of the sites actually, like Northern Light, when you go on, they don't have a wait list, so it's real time. If you go on and you find a site that has an appointment, you just book it. Just know when you're doing that, generally they're asking for your demographics. They'll ask you to have your insurance card. The Northern Light site has you book both appointments at the same time, so you want to have your calendar so you know when you're available. With the Maine Health site, if you're not in the eligible age group, it's a pre-registration, and you're just, I think, putting in a phone number, an email address, and a birth date. And then when you get into that eligibility group, they'll start to do that. There are some, depending on which medical practice you're enrolled in, some of them are reaching out directly to patients. And they'll they'll send an email or letter out saying, oh, you're now in the eligibility group. And so it's really depends on where you are. The good news is I think with the pharmacies, after the beginning of April, there'll be more openings in the pharmacy appointments as well out in the communities. And when you look on the list, it's a pretty widespread group of pharmacies geographically as well. So there should be pretty good availability. When more vaccine comes into the state, especially the J&J vaccine, we're anticipating a lot of the emergency medical services sites and fire and rescue have been giving vaccines. They gave a lot out at the beginning of March in community clinics, but there hasn't been a lot of supply of Johnson & Johnson in the state since then. We're anticipating more in April, and I think you'll see more clinics at the community level with your emergency medical, fire rescue, and some other groups that are offering those at the community sites as well. So, I mean, we don't know when in April the floodgates are going to open, but we're anticipating sometime at least by mid-end that we're going to start to see more vaccine come into the state. And it will take some time to get everybody vaccinated. I know people are pretty anxious, but it will take time to get people vaccinated, get both vaccines if they're using the mRNA vaccines, and move everybody through the process. So I know everybody on the phone has been patient, very patient, but we're going to have to probably be patient for another month or two to get everyone through that wants to get vaccinated.
Amy, are there any studies ongoing about the safety of the vaccine for individuals with diagnoses and those children with diagnoses? Do you know of?
Well, they're just starting to enroll the children, so
right.
That's the issue. Is we don't have the data yet on the younger groups.
So, were there any studies for adults?
Yeah, well, I was just going to say. So, in
Thank you.
They're not sort of studies for specific conditions, but in the large clinical trials that have happened, and it's 30,000 with one and 40,000 with another, they included people, and they specifically included people with medical conditions. In a lot of clinical trials of different drugs and interventions, they'll exclude people. They did not. They purposely tried to include people, so that's really the best that we have. So we know it's still safe and efficacious in people with some of those underlying conditions.
So if you have a 16 or 17-year-old, because on April 19th, so we're 3 weeks away from that, who has a diagnosis, would your recommendation to be to work with your, a lot of times when they have a diagnosis, they have specialty doctors or primary care physicians, but to have conversations with those individuals about your child and their vulnerabilities and their opinions on the safety of the vaccination, that would be the best advice for those individuals?
Yes, although I am very confident that, again, because the data shows these vaccines to be extremely safe now across millions and millions of individuals, that providers would, generally endorse the safety of the vaccine for anybody other than, a known severe allergic reaction to the first dose of a 2-dose vaccine. Otherwise, there truly are no contraindications to it. So it's certainly good to talk to people's providers about that. And I am highly confident that they would endorse use of the vaccine.
Great. This vaccination process right now, somebody's asking a question about if it will impact the new vaccination law. I mean, that's a legislative process.
Right. So the current vaccine is under emergency use authorization, so it really can't be mandated. But the other piece is with the vaccination law that has taken away the philosophical exemption that goes into place in September. It would have to be a legislative process to add it to the list of required vaccines for school entry. So we're not at that process, but the vaccination law that's currently on the books does go into effect September 1st. So that is still moving forward with the required vaccines that are already under that legislation.
Not this one. And just to expand on your comment, Amy, so states and the feds cannot mandate a vaccine that has emergency use authorization versus full approval. An employer could, though, potentially, and that's up to their own assessment of risks and benefits, but to differentiate state and federal versus a private employer.
Right. The vaccination law is impacting schools, so that would fall under the state, right? Oops, sorry.
Yes, and again, that would require a change in what rule or law, Amy, to actually add this, which they can't at all until it gets full approval. And then even if it does get full approval, it would require a change to add it to the list. It's not on the list right now.
Okay. I have a question about a family member whose whole house had COVID. The mom is still struggling with symptoms, inflamed eye issue.
affecting her eczema.
She
Can
still
she still
passed on
have-
COVID to me. So, yeah, I don't know. I don't, do we know, I mean, for some of those, 'cause we hear a lot about like the long haulers. Do we know how long people are contagious with it?
You know, I wouldn't say we know precisely with each one, but I think for the most part, after 14 days, people are considered not to be contagious. I think the long haulers, the persistent symptoms have more to do with, you know, the reactions that the virus is triggering. And again, we're not talking about the vaccine, we're talking about the actual infection are triggering in the body. But generally it is not that they remain acutely infected and are still shedding virus. It's that they're continuing to have symptoms related to the virus.
Great.
And
Thank you.
even after having COVID, the virus, you can still get vaccinated. And you can get vaccinated as early as after your quarantine period is done. Some people are waiting longer because they may have some protection from their antibodies for 90 days after after their COVID illness before they get vaccinated. But you could get vaccinated as soon as after your quarantine period is done. There have been just some case reports of those with long haul COVID symptoms saying that some people have felt better after getting COVID vaccine, but that has not generally been, you know, studied and put out and published. There's just been some anecdotal reports that some people have felt better after getting COVID vaccination.
Great. I'm not seeing any additional questions right now. Can we share the PowerPoint presentation with individuals who ask for it? Are you two okay with that?
Absolutely. Yeah.
Great.
Absolutely.
Thank you. There's a ton of information in there, very educational. From as much as I've been researching and digging for information for my own family and also for the families we serve through Maine Parent Federation, I learned a lot today. So thank you, ladies, for taking the information off the CDC site and making it family friendly, which is really what I had asked of both of you, because it's just hard for families, especially when you have children with special healthcare needs, to sometimes dig through the Maine.gov sites to get all the information that you're needing. And so awesome. So thank you so much for taking the time. I know you're both extremely busy right now, especially, and we appreciate you joining us today and sharing your time and your brains with us, because it's been extremely helpful, especially during a subject that can be very difficult for our families to navigate. So again, thank you so much for your time. Thank you, everybody, for joining us. If you, I'm going to put up a poll real quick. So if you could just take a couple minutes to fill that poll up, that would be great. And if you would like to, in the chat box, if you want me to send you the slides or a certificate, please put your email address and we'll be sure to get that out to you. I'll leave the poll up for a few more minutes, and we'll stay on for a few more minutes here at Maine Parent Federation for you to fill out that poll and to put anything in the chat box as far as email addresses for a certificate. We will wrap up our annual conference tomorrow. We have a session at 9 o'clock. Disability Rights Maine will be joining us to talk about compensatory education. And then at 1 p.m., Maine Parent Federation will be doing a presentation on Katie Beckett. So with that, thank you, Dr. Belisle and Dr. Letourneau, for joining us. And everybody have a great day.
Super.
Thank you
Thank
very
you.
much.
Take care.